Welcome to today's Explainer. We are diving straight into one of the most urgent yet wildly underdiscussed crises of our time, the post-antibiotic era. For decades, right, we've been completely conditioned to believe that modern medicine has all the answers. You get sick, you go to the doctor, you get a pill, and you're cured. It's the traditional path laid down by John D Rockefeller's allopathic model. But what happens when those miracle drugs just stop working? Today, we're unpacking a massive paradigm shift. From the source material, we're looking at a proposed solution from a whistleblower who says it's time to disrupt that old model and offers a true beacon of hope through decentralized AI-powered healthcare.
Prema Kiosk and Dr. Maya AI, building a people-powered network to protect families. A pandemic-ready community access system have been developed to help people make safer decisions when symptoms first appear. The system provides calm guidance before fear causes someone to rush to a clinic or hospital unnecessarily. It links individuals, communities, healthcare professionals, and public health services through one accessible network. This is not just another technology project. It's a mission to protect families before infections spread. The world is still not ready for the next outbreak. The next serious outbreak could start with people experiencing mild or confusing symptoms. Without trusted guidance, some ignore the danger while others panic and rush into crowded healthcare facilities. Both reactions can increase transmission, anxiety, and pressure on doctors and hospitals. Pandemic preparedness must therefore begin at the first sign of uncertainty, not after hospitals become overwhelmed. The gap Prema aims to close. Millions still lack a reliable first point of contact when worried about symptoms. Language barriers, limited literacy, and poor access to healthcare make this problem worse. Doctors then spend valuable time gathering information that could have been collected earlier. Prema establishes a structured link among the concerned individual, the community, and healthcare providers. Introducing Prema, Guided Community Decision Support. Prema is a multilingual, voice-first kiosk designed for both literate and non-literate users, as well as those who are digitally inexperienced. The user speaks or selects key symptoms with help from a trained local guardian if needed. Dr. Maya assesses the combination using color-coded clinical reasoning, not just a single symptom search. The result is calm, clear advice on the safest next step. How Prema works. Prema turns uncertainty about symptoms into a clear, understandable pathway for everyone. It does not require medical knowledge from the user or the guardian. The technology sorts the information, while the guardian offers reassurance, language support, and human presence. Within minutes, the user receives a straightforward direction based on all symptoms. 3 symptoms, 1 clear direction. The user identifies the 3 most relevant symptoms or concerns. Dr. Maya considers them together, not in isolation. This mirrors how an experienced clinician looks for meaningful patterns in patient's story. The guardian sees a clear instruction on the screen, but is not expected to diagnose or prescribe. The color-coded 3-symptom reasoning system. Dr. Maya does not choose a destination based on a single color. The final decision depends on all 3 colors. Red always takes priority. 3 red means go to the hospital. 2 red suggests consulting a doctor. And 1 red indicates speaking to a doctor. Blue indicates infection risk. Isolate, avoid travel, and seek nurse or doctor advice based on the combination. Green and yellow guide towards nurse or doctor consultation, pharmacy support, or home care. Important gamma correction. 3 blue means quarantine. 2 blue plus another color indicates asking a nurse or doctor. 1 blue plus another color indicates asking a nurse, with red still prioritized. 3 green means consult a nurse or doctor. 3 yellow means see a chemist. Blue flagging, an early indicator of infection risk. A person can carry and spread an infection without appearing critically ill. The blue category reminds individuals to isolate, avoid travel, and protect family, colleagues, and healthcare workers. With consent, privacy, and proper governance, anonymized blue data can reveal potential community clusters. This is an early warning, not a diagnosis or confirmation of an outbreak. Supporting healthcare workers, not replacing them. Prema can generate a structured summary of symptoms, duration, warning signs, and relevant history. With permission, this summary can be printed or securely shared with healthcare professionals. Doctors receive better organized information before seeing the patient, reducing repetition and improving focus. The clinical decision always remains with the qualified professional. Dr. Maya provides guidance, not diagnosis. Deployment and scale. Prema is designed as a flexible community access system, not limited to one building. It can support hospitals, clinics, pharmacies, villages, humanitarian centers, and public spaces. The core reasoning system can also be accessed via smartphones, websites, WhatsApp, or Telegram. This allows for gradual local deployment while responsibly refining and improving the system. Designed for every community setting, Prema can be positioned near hospitals, pharmacies, and clinics to organize information before consultation. It can also serve villages, markets, refugee centers, and communities where formal healthcare access is limited. Voice-first and touch-free interaction can support infection-conscious use in busy public locations. Multilingual communication ensures that literacy and language do not become barriers to receiving guidance. Prema Guardians, human reassurance and local employment. Every kiosk can be supported by a trained Prema Guardian who understands the local language and community. The Guardian is not expected to diagnose, prescribe, or replace a healthcare professional. Their role is to help people communicate, remain calm, and follow the instructions displayed by the system. This model can create dignified local employment while extending access to underserved communities. Ambulance and pre-hospital integration. During ambulance transport, Prema could help organize the patient's history while paramedics continue their assessment. It may be particularly useful when the patient is distressed, communication is difficult, or relatives provide incomplete information. With secure data transfer and clinical governance, the receiving emergency team could review the summary before arrival. This has the potential to improve preparation, communication, and continuity of care, not replace paramedic judgment. Pandemic preparedness must begin before the crisis. Dr. Maya was created from more than 4 decades of experience caring for patients in hospitals. The motivation was not to replace doctors or accumulate power, but to share clinical reasoning that could protect others. Healthcare workers also fear bringing infections home to their families. Prema seeks to act before hospitals, professionals, and communities are placed under unbearable pressure. How Prema supports public health priorities. Prema supports early warning by identifying patterns that may indicate infection risk within a community. It supports demand management by directing people to an appropriate level of care, rather than automatically sending everyone to the hospital. Its multilingual and literacy-independent design can improve access for populations often missed by digital health systems. These capabilities align with public health preparedness priorities, but they require independent validation and formal collaboration. Redirecting demand to the right level of care. Not every symptom requires an emergency department visit, but serious combinations must never be ignored. Dr. Maya uses the full color combination to distinguish hospital escalation, doctor consultation, nurse guidance, pharmacy support, and isolation. Structured summaries can make consultations shorter and more focused, without preventing people from obtaining necessary care. Blue infection risk guidance may also help interrupt transmission before formal test results become available. Prema does not diagnose disease, prescribe medication, or replace clinical judgment. It answers one practical question. What is the safest next step for this person at this moment? The explanation is delivered calmly and in a language the individual can understand. Every interaction should end with greater clarity, reduced fear, and a responsible plan of action. The proposal: validate, learn, and scale responsibly. The immediate goal is to conduct a carefully governed pilot rather than make untested promises. The pilot should evaluate safety, usability, triage consistency, user understanding, and the accuracy of escalation decisions. Digital and social media versions can help reach people, while physical Prema kiosks are gradually introduced. Doctors, hospitals, and independent reviewers must participate in validating the system before large-scale deployment. A 3-phase pilot and evaluation. Phase 1 will introduce Prema at selected sites with trained guardians, clear governance, and secure data management. Phase 2 will review outcomes such as triage agreement, community use, demand redirection, and possible blue flag cluster signals. Phase 3 will expand only after the evidence identifies what is safe, effective, and practical. Collaboration with governments, hospitals, or international organizations should be pursued after validation, not presented as existing endorsement. Why Prema? Why now? Infrastructure cannot be designed after the next public health emergency has already begun. People must learn now how to distinguish danger, moderate concern, minor illness, and possible infection risk. Prema brings together guided reasoning, human reassurance, clinician support, and community access into a single connected model. The purpose of artificial intelligence should be to serve life, protect families, and strengthen, not replace, the people who care for us. Join the Prema and Dr. Maya network. We invite doctors, nurses, hospitals, public health professionals, philanthropists, investors, NGOs, and community leaders to participate. We also welcome Prema Guardians, AI automation specialists, digital marketers, and individuals who want to protect their communities. Partners can attend a demonstration, examine the workflow, and help design a responsibly governed pilot. To begin the conversation, contact Dr. Kadiyali Srivatsa at info@maya, doctor, or +91 84311 33959. Closing message for the video. The next pandemic will not ask whether we were ready. It will expose whether we acted while there was still time. Join the Prema and Dr. Maya network. not to replace doctors, but to protect families, support healthcare professionals, and help communities make safer decisions before fear becomes chaos.
Doctor, he has had a fever for 3 days and the cough is getting worse.
Critical alert. Antibiotic resistance pattern detected.
The data from Sector 4 is critical.
Agreed. We must act now, based on this intelligence, not the old models.
Wait for crisis, 2028, 2035, 2 to 3 billion, plus catastrophic consequences.